Okay. Hi, everybody. My name is Donna Reid. I'm the lead respiratory nurse specialist at Forth Valley Royal Hospital. And I've got with me Louisa Anderson, who you can just see in the corner. She's one of the nurse specialists here. And we thought we'd maybe just give you some information about COPD and how to manage that at home. So COPD is a chronic obstructive pulmonary disease. It basically is a term that covers two conditions of the lung, chronic bronchitis and emphysema. It's predominantly a smoker's disease, although you can get COPD through occupational exposure. But most people get it through smoking, sort of lifelong smoking history. The symptoms of COPD come about really from irritation of the upper airways, where you get narrowing of your bronchus, and you also get an excess production of mucus in the bronchus. And normally the job of the mucus is to, when you breathe in and you breathe in any dust particles, this mucus would trap that, and then there's little hairs inside the bronchus that have this kind of escalator effect, and they kind of move the dust back up in the mucus, and you would normally swallow that. But with COPD, what happens is you get an excess production of mucus, and these little hairs, these little cilia stop working effectively, so you don't get to clear the airways quite as well. So effectively what you've got is inflammation which narrows the airway and can cause breathlessness. And you've got the obstruction there, which can be the mucus, these mucus plugs that kind of sit in the airway. Chronic bronchitis is the inflammation, narrowing of your airways, and a cough which produces phlegm. Emphysema occurs sort of further down in the airways, where normally you breathe in oxygen, oxygen passes through little alveolar sacs at the end of the airway into your capillaries, your bloodstream, and the oxygen's used as an energy. It keeps your organs healthy and it gives you energy to do things, get your muscles moving. Emphysema is when these areas, the alveolar, get damaged, they can collapse in themselves, and they get trapped air in there, and we get ineffective gas exchange. So that can result in breathlessness as well, and also maybe a lack of circulating oxygen, which can cause fatigue. So that's two of the main symptoms really. COPD is a progressive disease. So these symptoms start after many years of smoking, and they might initially notice that they're a bit breathless when they've been out in the cold weather, maybe climbing a hill, and these symptoms then get progressively worse. There is no cure, obviously, for COPD, but we can help manage the symptoms with inhaled therapy. And these inhalers help to open up your airways and make you breathe a bit better. And you can get different combinations of drugs in these inhalers, but basically they all come to the same conclusion. The aim is to open up the airways and help your breathing. So the one intervention that will make a difference if you've got a diagnosis of COPD is stopping smoking. We can't repair any damage that's been done to the lungs, but you can slow the progression of the disease at any time by stopping smoking. And there's lots of ways you can get help with that through your GP. All practices have got smoking cessation services. They'll give you support as in a telephone support. They also provide treatments such as nicotine replacement therapies. They come in the form of patches, gums, lozenges. You can get inhalators. You can also get treatment that it's not nicotine replacement, but it helps to block the receptors in the brain that get the dopamine effect from the nicotine, and that's a drug called Champix, and that helps with the cravings and things for stopping smoking.
The other place that you can get help from is the pharmacist. A lot of the pharmacists and the chemists, they'll help you as well if you need support, so they're very good as well, so you can get help for them.
And I would say that if you're caring for somebody with COPD and they're still smoking, and if you're smoking this too, it should be a joint effort to improve the health of both yourself and the person you're caring for. So maintaining an exercise regime or being as active as you can is really important to keep your muscles active. When you're not as active, as you normally would be because you're breathless and you're tired, what happens is you don't do as much and your muscles become a bit weaker, a bit more fatigued. And then when you go to do something, you feel even more breathless or even more fatigued.
It's so hard when you get deconditioning to get back from that space. So it's if you can keep it going steadily, doing a wee bit, and not just, a lot of people like to think I'm just going to sit in the chair because I'll not be as breathless, but that's actually the worst thing you can do. It's always trying to do a wee bit all the time.
So we do recommend that you do exercise, but you do it at your own pace. So if you have to stop frequently, going for a walk, set yourself a goal. You know, I'm going to walk 3 lampposts today. If that's your goal, but you can do it by pacing yourself. So stopping frequently, just recovering, getting your breath, and then carrying on again. And actually, you'll reach that goal. You'll make that goal, rather than trying to do it all in one attempt, becoming really breathless and distressed and giving up. So,
and it puts you off, so you're not going to do it again.
So pacing your activities is really important. And then how you move as well is also really important, because when you're breathless, it's all these upper muscles here that are affected. So if you're doing anything like hoovering, I don't know if you hoover like that at home, but awesome. But if you're hoovering, dusting, or reaching for things in cupboards, there's things you can do to conserve your energy. So I'd recommend, if you're reaching for something, to blow out as you do it, because it expends less energy and puts less strain on your intercostal muscles, so you won't be quite as tired. Talking about energy conservation, when you come out the shower, don't take a towel and rub yourself all over to get dry. Invest in a nice warm terry towel and dressing gown, put that on and just dab yourself dry, and you won't be as tired or as exhausted after just getting a shower, because we know that can be really tiring. We do an exercise program at Forth Valley called Pulmonary Rehab, and your GP can refer you for these kind of exercises. In fact, Louisa's instrumental. She's the one that runs the program here at Forth Valley. So I'll let her tell you a wee bit about what pulmonary rehab is, because that's all about exercising and maintaining a healthy kind of lifestyle.
So pulmonary rehab is designed specifically for patients who have a lung condition. And it's been decided over years is what else could we do for these patients, but it's actually classed as part of the treatment now, doing exercise, because you're helping to get yourself a bit fitter. We're making you more knowledgeable through the education slots as well, so that you know what you're doing, because the quicker you act when things are not well with your breathing condition, your COPD, the quicker you get better, and the fitter you are, it doesn't take you so long to recover as well when you're doing that. So we run a class here which is twice a week for 6 weeks. At this moment in time, we're doing a virtual one, but we do face-to-face normally, but that is something that we hope we'll get back, hopefully, in the near future. So pulmonary rehab is definitely something that is good for you, but as I say, it is a wee bit harder when you've got deconditioned and you've not been doing anything to get yourself back up. And that's why it's good starting off really slowly, as Donna says, and pacing yourself wee bits at a time. She said the 3 lampposts, you can do 1 lamppost at a time. So we're all about pacing yourself and teaching you what to do. So pulmonary rehab is definitely one of the best ways to go. The other thing that we teach as well, which is quite good, is about anxiety. Because this is a condition that we can't cure as such, you get worried about it. You get worried about being breathless and that. So anxiety and depression runs alongside with the COPD. So we've got lots of information about that for you to do that as well. And don't be frightened to go to your GP and ask for help for that as well, because that is something that if you're got some medication for that, that might help you be able to do something a wee bit more with that.
And it can help you cope better with your breathlessness if mentally you're in a better place. I think the other thing that's really important when you're managing COPD or you're looking after someone that's got COPD is, and it can be quite difficult, is maintaining a healthy diet. And partly that is because of the mechanics of what's happening in the lungs. With the air trapping, the lungs become a bit hyperinflated, more inflated than they would be, and it presses down on the diaphragm, the muscle under your lungs, which sits above your tummy. So a lot of people feel full before they even start to eat, and it's just because of that muscle pressing on their tummy. And then when they do try and eat, they can feel breathless just with chewing and swallowing. So We do recommend that you graze through the day small amounts rather than sitting down to 3 big meals, a breakfast, a lunch, a dinner. You eat small amounts frequently, and you eat foods that are high in protein. That helps kind of maintain your muscle mass, but also lots of fresh fruit and veg, things that are high in calories if you're underweight, and avoid high salty foods or high fat foods if you're overweight. Because if you're the opposite end of the spectrum and you're carrying a bit of weight, that is only going to affect your breathing. It's going to make you more breathless. So in those situations, you should be looking at a weight loss program to help your breathing.
When you get breathless, you tend to breathe a bit heavier, so you tend to breathe through your mouth, so you dry things up a lot quicker. So it is really important that if you've not got a cardiac history as well, that you try and drink as much fluid as you can. We recommend about 8 pints of fluid, 8 glasses of water or something like that a day, to keep these secretions nice and moist, because what happens is when you breathe heavier, your secretions get drier, they get thick and stickier, and that's when they start to get into problems in the lungs, and then you end up with infection. So it is important that you drink plenty of fluids in the day. Watching out for stuff that's got caffeine in it, because that will make you drier as well. Water's really good, diluting juice is good, so all these kind of things as well.
What they've got to know is what they're like when they're well, so that they can recognise when there's a deterioration in their COPD, which is more often than not caused by an infection, whether that's viral or bacterial. But if they can recognise changes in what's norm for them, so if every day you can do the stairs without any problem, and one day you got to do the stairs and you've got to stop halfway because you're so breathless, that's a change. If their spit's normally white and one day they bring it up and it's green and they're breathless, that's two things that are indicating something's not right here. And then the other thing, I suppose,
It's a lot more phlegm than you normally
if
have.
they bring up more and if it's thicker and harder to bring up, like Louisa said. And some GPs will allow you to have a wee emergency supply of antibiotics and steroids. It's something you can discuss with a GP. But I'd still recommend that you phone them and let them know what the symptoms are, so that you can get the advice from the GP whether you need steroids and antibiotics or just steroids on their own. But it's quite handy sometimes to have that emergency supply so that you can start treatment quicker. And then if you're able to recognise symptoms, you can manage your condition much better at home. It prevents you coming into hospital, prevents you going to GP surgery, because you've got all the things and all the toolkits there to manage it yourself, along with your healthy diet, your exercise, your lifestyle changes such as stopping smoking. All these things can make a huge difference to your symptoms. So it is important that you have an annual review at your GP practice. One, to check you're using your inhalers correctly, because we have seen it. I've been doing this job for about 20 years, and people will tell me that they use their inhalers and they know what they're doing and they're putting it on here like perfume, and it's not actually being used correctly, because we all get into bad habits and we all take shortcuts. So you should always have your review at your practice. Your practice nurse, she'll check your inhaler technique. They'll do some breathing tests and just keep an eye on how your COPD is going. And they can give you advice on management and refer you to things like the exercise classes that we're talking about, the rehab. And also it just keeps an eye on your condition. And they then are able to refer you to the specialists if you need that. If you need a specialist input, like from the respiratory nurses or a respiratory consultant.
The other thing I would mention is just to make sure that you get your vaccinations regularly, making sure you have the flu vaccination. The one for pneumonia, that's a one-off. So if you've had that once, you don't need that again. And obviously the big push is making sure you have your COVID vaccination as well. And you need to have both of them, 1 and 2.
There are other things that we would help to manage COPD, like nebulizers and things. But I think if you're at home, you can do basic things like open a window. Air movement helps with breathlessness. Putting a fan on. A fan is really effective at relieving shortness of breath. So if you're with someone who's having an exacerbation where they're really breathless and they're panicky, the best thing you can do is open the window, get a fan on if you've got one, just calmly talk to them, try and distract them. Sometimes if you just put a hand on their shoulder, you'll feel that tenseness there because, and that this is where their shoulders are, they're up at their ears because they're so tense and anxious. And if you just get them to, on the next time I'm going to get you just to and relax your shoulders. And straight away their breathing will slow down because it's just dropping your shoulders and relaxing. And there are some techniques online as well that you can look at for positioning people that are short of breath. And sometimes leaning over helps, leaning back against the wall, lying on your side, sitting upright in bed. There's lots of things that you can see online that help to relieve breathlessness. If you are looking to get an idea of what kind of exercises you can do at home, Forth Valley Royal Hospital have got a YouTube video of the pulmonary rehab programme. So if your carers want to access that, they'll be able to do the programme at home. It shows the kind of exercises we do, and it would just help keep them a bit active.
There is another website that's really good. It's called My Lungs, My Life, and that's a really good one as well. And Chest, Heart and Stroke and BLF do really good booklets, leaflets, and different links that are really helpful for patients as well, and for helping with the symptoms of breathlessness, helping you to build things up in that. So these are two really good websites for to do that as well.